Some people on a kidney diet need to watch their potassium intake. Potassium is a mineral found in fruits, vegetables, and other foods, and is important in the diet because one of the things it does is control muscle movement. And we've all learned that the heart is the most important muscle. High potassium levels can lead to irregular heartbeats, or can cause the heart to stop beating altogether. Extra potassium is released by healthy kidneys to keep the potassium levels from getting too high or low. In later stages of kidney disease, when kidneys cannot perform this function, then potassium intake needs to be monitored. Your renal dietitian will likely give you a list of foods that are high in potassium to limit or avoid, such as tomatoes and bananas, as well as a list of fruits and vegetables that are lower in potassium with a guideline for portions. You can find information about potassium at davita.com, along with a list of high potassium and low potassium foods. Fruits and vegetables provide vitamins, fiber, antioxidants, and phytochemicals that protect against heart disease, cancer, and inflammation. Fresh fruits and vegetables are a great choice because there is no sodium added. However, for convenience, low sodium canned and frozen options can also be beneficial. Keep several canned fruits on hand for a quick snack, dessert, to add to a salad, or make a sauce. Many lower potassium fruits are available canned, but a few canned fruit cocktail varieties do contain higher potassium fruits such as papaya and banana. A recommendation is to drain the liquid from the fruit to eliminate some of the potassium, as well as limit fluid if you are on a fluid restriction. Choose fruits packed in syrup for more calories, or if you have diabetes or are controlling your carbohydrate intake, choose fruit packed in juice or water.